Hello and welcome dear learners on the NIPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In the Module 1, the Foundation of Healthcare Quality and Infection Control, we'll be discussing more on the importance of quality in improving patient outcomes and health system performance in Indian hospital. We'll be taking in discussion of the NABH accreditation, digital health for care, and quality indicators and continuous quality improvement. These all four topics will be discussed in the current lecture. NABH accreditation we have heard in the previous class actually where the NABH stands for National Accreditation Board for Hospitals and Healthcare Providers. In India, the major authority for healthcare quality and patient safety standards. It is a very promising approach in board where it gives major emphasis on improving the culture of healthcare quality. NABH is a part of Quality Council of India and works to improve the outcomes in public and private healthcare. Even the public hospitals are also initiating towards taking the accreditation of NABH. Its accreditation and certification programs promote ethical, evidence-based and patient-focused practices. NABH helps make patient healthcare safer, more consistent and better regulated across India. NABH core values are credibility, responsiveness, transparency and innovation. Where do we find that the credibility provides trustworthy and useful services, which is very important actually to take an accreditation by NABH. Responsiveness, which gives listening and continuously improving the services, which is very important in continuous of care. Transparency, which share information openly with the stakeholders. It can even be the patient who can identify as a stakeholder. Encourage the new ideas, creativity and learning, which is very important that NABH core values comes with improving credibility, responsiveness, transparency and innovation. NABH was established in 2005 to meet the growing need for structured quality assurance in Indian healthcare. It has been seen that it started with larger hospitals and now slowly going towards the smaller healthcare organization, hospitals, clinics and laboratories and even traditional medicine centers of Ayush and digital health systems. NABH has helped in creating more ethical, transparent and reliable healthcare system in India. NABH is recognized internationally as a full member of International Society for Quality in Healthcare, that is the Ishikawa. This recognition confirms that NABH meets global standard and enhances the reputation of accreditation in Indian hospitals including medical tourism and international collaborations. NABH supports small and rural hospitals through entry-level certification and small healthcare organization accreditation programs where we find the SHSCO actually has been very promisingly accepting the NABH. This program teach basic quality and safety practices, provide training and mentoring them, and also very simple to implement this in these hospitals. They help hospitals improve patient care without heavy documentation and high resource need, which is sometimes being seen as a major obstacle to receive NABH. NABH accredits and certifies a wide range of healthcare institutions, including large hospitals and small healthcare organizations, dental clinics, eye care centers, and emergency departments, Ayush hospital, Panchakarma centers, and traditional medicine practitioners, imaging centers, pathology labs, and blood banks, nursing services, care homes, and ethical committees. So from digital health platform to HIS, EMR vendors, all those are very included actually into the gamut of NABH. Each of the programs that are enlisted is designed to meet the quality, safety and operational needs for the specific type of the healthcare facility which is being chosen. So if you can find there is a very micro level distribution of understanding all these institutions, and it has paid major credit actually that NABH accredited hospitals or certified are coming with all the best of the facilities. Now we go on discussion with the digital health for quality. As we all know, the Ayushman Bharat Digital Health Mission, which is launched in 2021 to strengthen the India's digital health system, and it is very promisingly to see that ABDM has integrated the health data records, the registers to make patient information easier to access and share. And it has been found very helpful to even the patient also that the ABDM is managed by the National Health Authority. India coordinating with the central and the state government, private sector and civil society organization, where ABDM is being seen across India. The main goal of ABDM is to manage digital health data and allow safe, standardized healthcare across the providers. ABDM builds a unified digital health infrastructure using a federal architecture and standard norms of electronic health records. It gives major benefits actually to the understanding the needs of the patient and to make patient more accountable of their records. It involves multi-stakeholders, including policymakers, administrators, hospitals, lab, pharmacies and healthcare professionals. Insurance providers, which are very important now for providing the digital health for quality, health tech companies and NGOs. Ayushman Bharat Digital Health Mission aims to improve decision making at the health system level and provide patient with secure and shareable medical records, which is very important to see that the major benefit is more to make patient more responsible for their health needs. ABDM focuses on main 5 digital activities where we find that the Ayushman Bharat health account, that is the ABHA card, assigns each patient an unique 14-digit ID for digital access to personal health records, which is very important actually to see that the patient has its own records and a person ID actually. The ABHA mobile app. The ABHA mobile app allows patient to register link their ABHA ID. The Ayushman Bharat health account ID with provider store health records in digital locker and share them to the consultant, to the doctors and to the institutions and seek the treatment. So in a way, it is more focusing towards getting an individual accountability towards their own healthcare needs. In aligned to this, the ABHA focuses with the healthcare facilities also. And the third 5 main in activities actually which is being taken in the ABDM is the healthcare facility registry. List of all public and private healthcare facilities, which is very important. Many times the patient has to struggle what are the facilities which are in my vicinity or what are the facilities into the state or into the district, including the diagnostic centers and pharmacies. Supports geospatial mapping actually, which has become very important actually to identify where the facility is. Regulatory processes and even data exchange, which is now not a cumbersome activity that the patient can take. The healthcare professional registry, which we find that it is very important not only for the healthcare providers but even for the patients. The registry of doctors, the registry of nurses, the registry of even the paramedics and even the other healthcare professionals. All the 4 registries are very important individuality to be sought by the patient, which is very important for them to give an access to their digital health records. Teleconsultation, which is a growing need in the current times. Administrative processes which are linked with registrations and renewals. All these activities which are now going digitized are more with the benefits of the ABDM. The major success of growing, of getting paperless or even moving towards getting the digitalization of health record is more because of the initiatives of ABDM. The unified health interface actually. This provides a platform for appointments, teleconsultation, diagnostics and even record retrieval. Record retrieval is one which is important for all the follow-ups to all the healthcare performances actually that the healthcare organization always try actually to help the patient actually to make more better outcome of and use for ratings and even for service quality. Most of the hospitals who have availed this actually and have tried actually to make benefit to their patient is more for ensuring the safer and standardized digital health data and even sharing with the patients and the providers, which becomes very important for all those providers who are taking the benefits of this and the patient who are availing. It is improving actually the access to healthcare. The very important benefit of access to healthcare lies actually to the patient and even supporting the telemedicine option, where sometimes we find in the remote areas the patients are not getting benefits of the healthcare facilities. And it is also that the ABDM is being seen to strengthen the overall health system efficiency. EMR, the electronic medical record. Previously, that EMR was not really being seen as a very important, and people were not really even thinking that they may have their own EMR. EMR is somewhere we can say that it replaces the paper records with the digital and centralized system. EMR are one to be seen as every patient will have their own medical records digitally. It helps to store the patient the information like medical history, their prescriptions, their medication, their allergies, their vaccination, lab report, diagnostic image, and everything that the patient really is interested to give. It is stored in the form of digit. Supports this as to the doctors in decision making with alerts actually for drug interactions and treatment reminders, which has very much improved and has been patient friendly actually. It helps supports the patient actually for not only those patients who are struggling with ailing illnesses like cancer and HIV, but even for all those patients who are with diabetes, hypertension and other disease condition. It helps patient access to health record and share information with the doctors easily. It is very promisingly helping actually even to the elderly patient also, who identifies many times as a major deterrent to get with electronic health records. What are the benefits of electronic medical records? It is towards a better quality of care. It improves the efficient patient safety issues, easy accessibility and simplicity, which is very important to avail the digital records actually. Instant help during emergencies, which is very important that the electronic medical records are to be identified as something which improves majorly into the emergency care. And preventive care and monitoring, sometimes actually we may not know where a vaccination is due for, or sometimes actually very preventively it is affecting actually why and in what way actually if we are traveling or even we are taking any doses, or even sometimes who is on a chronic treatment actually, the preventive care and the monitoring is very important. So electronic medical record is helping a lot for a patient. Now comes telemedicine. So telemedicine allows healthcare delivery in areas where limited access to doctor or specialties there, especially into the remote belts of our country, where we find that there are lot of vulnerable population actually, marginalized population actually, who seeks major benefits of this telemedicine, especially into the tribal belts of our country. It is very important, and even the remote where the access to healthcare is very difficult. So it enables remote consultations, it gives more better follow-ups and even real-time monitoring of patient. Even there is a scene that we have seen lot of tele-ICU which are developing nowadays, where a physician from city like Mumbai can even see his patient who are in consultation with him in tele-ICU in the state like UP. So it supports digital health education and guidance for the patient. It makes healthcare more accessible, responsive and patient focused. So if I have to emphasize more on the part that accessibility is not only now in constraint, but responsiveness and patient focusedness is one that the healthcare providers are giving. So telemedicine has opened door for continuity of care beyond the hospital. The hospitals are promisingly welcoming the patient, even the patient lying at the bed of the home. Telemedicine allows providers to identify health issues early and guide self-care and intervention where sometimes you may not know and when to approach the consultants. So telemedicines open the doors for all this. It improves care delivery without requiring patient to travel, and the time is saved, the cost is saved, and sometimes even most of the important hurdles which come across in accessibility are being saved over here. So telemedicine must be reliable and integrate well with existing healthcare system, which is a need, and sometimes we may find that the hurdles which comes majorly in telemedicine is more with the integration part. Technology alone is not enough to give telemedicine. The system should be easy to use for both patients and the providers, which is very, very important, where all the benefits of telemedicine lies actually into the hands of not only the patient but the providers. Clear protocols are needed for escalation and even for referrals. Because if though we don't have protocols, it finds the activity gets failure. Remote care should connect with the broader clinical team and the medical records. Because if though we don't find that the person who is on the other end actually is not well efficient to understand or not well capable or even skilled, the entire activity again goes very failure. So without proper integration and proper technology support, telemedicine can become fragmented and reduced care quality. The quality indicators in align with the next discussion, which emphasizes more on the safety aspects, where measure how well healthcare staff care without harming patients. So where the patient safety is more emphasized as one of the very important quality indicators. The safety is like unidentified effects from the procedures like respiratory failure or bleeding or blood clots or infections, and so lot of the unprecedented issues that the patient may encounter. So emphasizing on safety is one culture that the healthcare institution should increase, or I may say imbibe actually as a part of a philosophy. So common safety measures should be there, where you should try more to emphasize on reducing the healthcare acquired infections which are caught during the hospital care. Example, bloodstream infections, UTIs, surgical site infections, ventilator associated infections. So these are very commonly, or I may say that we are very high in proportion that this infections comes a lot. Then comes actually the medication errors, mistakes in prescribing, mistakes in giving the medication, or even dispensing the drugs which is encountered at the pharmacy counters, like even wrong dose or even missed dose. It can be through nursing, it can be through pharmacy, it can be even through a doctor, and even all the other players where medication error are encountered a lot actually, and it affects major safety issues of the patient. Pressure injuries. We do encounter a lot of a time bed sores to the patient. Sores that develop when patients are immobilized for a long time. Palliative care, hospice care, cancer patient, chronic renal failure patient, HIV patients, and so long even the geriatric patients also. They come across with a lot of issues with bed sores. Patient falls in the hospital, especially those causing injury during the care, or sometimes when there is no proper monitoring or there is no proper vigilance, may even affect. Majority of the patient falls are there when the patients are using the lavatories, or sometimes when the patients are having their movements, or sometimes in a need of communication also, they may get affected with lot of patient falls. Then comes the discussion of adverse events. The harm caused by medical care, particularly when the healthcare providers may also be more responsible of giving the adverse event. Just like surgical complications or allergic reactions, where sometimes when you have not taken a proper history, or sometimes your surgical procedure goes complicated, or sometimes there is a very strong system error which has encountered this. So all this can be tracked per 1000 patient days, doses or patient. So the metric should follow industry standards and regulatory guidelines. Patient experience also comes as a measure how patient view the care they receive. Patient also shows how well doctors and staff involve patients in decision and communicate with them. So it is very important that you can emphasize actually that the patient shows well with the doctors. Assist using patient surveys and complaint records. Is it very important that you have to keep this complaint records? Yes, it is very important, because then and then you can get the proper feedback of the patient and you can improve to say that yes, because of this we are able to track actually the patient where the patient really needs. The survey results to improve hospitals, the services and even the patient care. So sometimes your services might be very faulty. Sometimes the providers also may have some set of a misunderstanding. So this can be very improved by the patient experience. The patient experiences paves a lot to improve the healthcare facilities. Then comes the discussion of timely and effective care. So what is time and what is effectiveness connected to? There's a very important thing where timely care is very importantly with the effective care. So quick and proper care improves patient outcomes. It is always said that if you are able to provide timely care, it gives major patient outcomes. Most of the patients' need is more with the time. The safety aspect will come in next line, and the satisfaction no doubt will be affected if you are providing the care very timely. It reduces the delays and increase hospital efficiency. Lot of the hospitals inefficiency is majorly being seen because they are not providing timely care. The value of the time is more with the patient's health outcome. What do we see generally in a picture, whether it is a public hospital or sometimes it is even being encountered even in a private hospital also? Long emergency department waiting times or even long queues in the OPD areas. How does it really affect the patient? It affects the patient with the morbidity. It even leads to a lot of mortality issues, longer stays and higher cost. So entire thing gets very complex even only with one of the facets of not understanding the time importance. So timely care is very important to give the best outcomes. Effective care is measured by following clinical guidelines. The point is not towards seeing that the staff is not well skilled, but following or adhering actually to the clinical guidelines is very important. Monitoring the treatment outcomes, because the interconnectedness of guidelines and monitoring treatment outcome is very important to give a very effective care. It is not that actually surrendering actually towards a guideline, but understanding the guideline and giving more procedural care. Along with this, there are alerts that helps clinician update the care practices if needed. Lot of the time it is being seen that most of the healthcare practices are more that the alerts are not being taken very seriously. Readmission. The measures how often patient return to the hospital after discharge. It is not that the patient always should come up for a follow-up actually. Patient do need to come up for the follow-up, but if there is a readmission, it is something that the patient has gone through a wrong sort of healthcare. Might be the HAIs is very common, sometimes actually the faulty procedures. So high readmission rate may indicate poor care, discharge planning and follow-up. So these are all interconnected: poor care, discharge planning and follow-up. So we do find low readmission rates indicate better quality. Always, if the patient has to come within 1 month or 2 months or 3 months for a follow-up, that's a different story. But if the patient has to come for the same condition, again for the same treatment, then it is a readmission. Most of the patient readmitted within 30 days, and this is a very bad sign towards indicating a poor care that the hospital has given. If the hospital has this sort of a culture, actually it needs to balance actually the length of stay of the patient and even preventing the readmission, which improves the health outcomes. If the hospital is not working on the length of the stay, it is being stated that the quality of care is compromised. Then comes the issue of mortality, where it measures how a patient died during the hospital treatment. So do we expect that a patient die? Yes, there are majority of the issue. If the care is not taken properly, the patient may die. And hospitals are to be repeated, least said that they are the most places where patient encounter a lot of failures and patient result in dying over there. It reflects the effectiveness and safety of healthcare services. So mortality can be tracked to see how the care meets recovery. Morbidity is not to be leading to mortality, but it is more towards a need to be seen in form of a recovery. So mortality indicator helps identify areas where care can be improved. Mortality shows how well patients survive after surgery or treatment. So mortality indicator is very important that a healthcare provider should always keep in a track. Continuous quality improvement, that is CQI, and this word is very much uttered, and it is a very continuous effort to improve the process, safety and patient care. The goals can include better operations, outcomes, systems and work environments, or meeting regulation. Improvement can be gradual or through major changes. The continuous quality improvement is where you can define the problem, you can compare the current performance, what is going on over there, and even set a goal actually where you can say that the continuous quality improvement is just being taken like a project in a hospital. And even in that project, the care of iterative improvement projects of scope of improvement also should be there. Improvements are measured by the cycle which we have already discussed in the previous chapter, that is all of PDSA, that is plan, do, study and act. And it is very important, very simple and repeatable method, and it is very time tested where you can get a real clinical settings. Clinical audit, as I've already discussed, is a very structured review of care using a standard set of standards or criteria where you go up with the steps including choice of a topic, taking suppose infection control, or you can take discharge procedures, or even you can take lot of issue of medication errors also. Collect the data on the current practices, compare with the best practices and identify the gaps actually to make this improvement. Re-audit also to check the process, and all this is a very continuous process. You can do RCA also. RCA is also that we will be discussing more in the continuous chapter, where you identify a lot of errors, adverse events and near misses also. And tools like 5 whys actually, or even fishbone, Ishikawa diagram can also be discussed with your team, and you can identify short-term as well as long-term solutions actually to prevent this reoccurrence. Thank you so much for this patience listening. Thank you.